Good evening. You're watching the main news on HKIBC. I'm Johanna Chan. Here's a look at tonight's top stories. Carrie Lam denies lacking forward thinking in tackling COVID and ruled out mandating jabs for the elderly. A third jab is now needed to dine in at restaurants and visit supermarkets by the end of May, 1 month earlier than originally planned. And Rafael Nadal is on the edge of glory at Indian Wells after extending his winning streak this year to 20. The chief executive said there are no plans for now to impose a vaccine mandate on elderly citizens, but said she found it sad that some family members have blocked them from getting a jab. Carrie Lam also rejected lacking forward thinking and pointed to a sewage surveillance program for catching 23,000 infections. Johanna reports.
At her daily press conference, the chief executive rejected suggestions that her government has been reactive instead of forward-looking in formulating COVID policies. Carrie Lam cited a massive sewage surveillance scheme which covers the households of 5 million people and admitted it's costing quite a lot of money. Environment Secretary Wong Kam-sing, whose bureau is spearheading the program, said restriction testing declarations have been made on around 180 premises since late January. Around 23,000 infections were subsequently found, a detection rate of nearly 10%. He added the viral load in sewage samples has been closely in line with infection figures 4 days later, meaning the test can help authorities predict the upcoming trend. On the other hand, Lam denied the current round of social distancing measures, which came in mid-February, were too late. She insisted similar rules were already imposed in January.
The intervening Chinese New Year has been most unfortunate for Hong Kong because despite all the warning from myself, the Secretary for Food and Health, and all the social distancing measures, the reality is during the Chinese New Year, there have been a lot of cross-family gatherings. And as a result, this highly transmissible Omicron was spreading like fire.
She also ruled out mandating vaccinations among the elderly by law. Around 1 in 10 care home residents will not be getting a jab after their family members tendered written notice blocking the inoculations. The chief executive said it was sad to learn that some people still refuse to let their elderly family members at care homes receive a COVID vaccine. She also asked for the media's cooperation to promote the importance of vaccinations instead of focusing on 1 or 2 deaths after getting a jab. Johanna Ho, HKIBC.
Hong Kongers will be required to get a third shot by May 31st if they wish to dine out and visit malls and supermarkets. That is compared to the original deadline of June 30th, when the third phase of the vaccine pass is scheduled to kick in. Uninfected citizens aged 12 or above will only have a grace period of 6 months, rather than 9 months to receive the third jab after their second dose. The Center for Health Protection said there is enough capacity at vaccination centers to speed up the process. An online system will also be launched for recovered patients to retrieve a QR code, which they can produce as proof of exemption. Infectious disease expert Yuen Kwok-yong said the coronavirus is here to stay, as he offered his take on whether universal testing is still necessary for Hong Kong. He also believes now is the time to gradually roll back social distancing measures.
With the 5th COVID wave already past its peak, scientists are trying to put the latest outbreak into perspective. Microbiologist Yuen Kwok-yong estimated at least 1/5 of Hong Kong's population, or 1.5 million, have been infected. Speaking on radio, the government advisor was hopeful daily cases can drop to around 10,000 in the coming days, and triple digits in a few weeks, provided everyone remains vigilant. Asked whether universal testing was no longer necessary, he said that would depend on whether there are enough facilities to support the massive exercise. In case there is another rebound, $2 billion will go to waste, Yuen said, referring to the potential cost of the scheme. A more pressing task is to persuade the unvaccinated to get jabbed so that the SAR is in a better position to face another outbreak. He recommended people choose BioNTech, which, compared to Sinovac, offers better protection against COVID variants such as Omicron. Elderly citizens may also need an annual jab to boost immunity. The usually conservative infectious disease expert said it was time to gradually roll back restrictions, starting with an inbound flight ban on 9 countries.
The amount of cases in the community is far higher than the risk of introduction from overseas travelers. So I do not think there is a need to wait any longer.
The expert also blamed the government's slow response for the death of more than 5,000 people in the current wave. Going forward, he urged authorities to discern COVID-related deaths from those who have the virus but pass away from other complications to ease anxiety.
As the public eagerly awaits a possible relaxation of COVID regulations, daily infections have returned to the levels of last month. There were just over 14,000 cases yesterday, although deaths remain above 200.
Hong Kong's COVID caseload fell for the 4th day in a row. At 14,149, the daily uptick was the fewest since February 25th. Of the new infections, nearly 60% came from rapid antigen tests. The once raging outbreak at care homes seems to be under control. Only 2 more facilities came down with the virus yesterday, involving 15 residents and 2 workers. But not going down was the death toll, as another 205 patients passed away. They were aged between 44 and 104. Over half were not vaccinated, while most of the younger fatalities suffered chronic illnesses or underlying diseases. Along with a backlog of 41, Hong Kong has logged 5,683 deaths since the 5th wave began. To ensure adequate manpower at public hospitals, the Asia World Expo, and other facilities it manages, the hospital authority is handing over operations of the Tsingyi Community Isolation Center to a private organization.
We have a transitional period. That means our HA staff will work with the the medical group staff for a few days in order to teach them how to carry out the job. But it's not difficult because they are doctors and they are nurses. They have full knowledge about how to take care of the patients in the isolation facilities, because most of the citizens who are living in the isolation facilities have no or very mild symptoms.
Authorities are also calling on some people who have not received feedback after registering on the RAT platform to check if any apps or settings are blocking incoming messages.
Local cases continued to surge on the mainland, with the northeastern province of Jilin adding almost 1,200 patients yesterday. Provincial capital Changchun accounted for 833 infections, while more than 300 cases were found in Jilin City. Overall, the mainland recorded 1,656 new cases, as well as 2,177 asymptomatic infections. Guangdong province registered 51 patients, all but 2 from locked-down Shenzhen. Public transport will resume tomorrow in the major tech and manufacturing hub, as authorities claimed to have reined in the latest outbreak. The Ukrainian city of Mariupol is on the brink of submission following weeks of intensifying Russian assault. Both sides continue to point fingers at each other, although there are now signs the stalled peace talks may resume. Sarah Wang reports.
Weeks of relentless Russian airstrikes and intensifying fighting on the streets have pushed Mariupol to the brink of collapse. Over 2,400 people are said to have been killed in the besieged southern city, while thousands more were trapped underground in cold and dark conditions. They included some 400 people seeking refuge underneath a school, which was reportedly bombed by Russian forces. At a theater which was hit days ago, hundreds of survivors hiding in the basement are still yet to be evacuated due to skirmishes on the ground. Moscow is determined to seize Mariupol, which connects the annexed Crimean Peninsula to the rebels-held Donbas region in the east. Ukrainian President Volodymyr Zelensky accused Russia of committing war crimes by encircling Mariupol and targeting civilians. The Russian military in turn blamed Kyiv for orchestrating assaults on facilities of Western countries. A defense ministry spokesman also claimed it had neutralized an underground arms depot in western Ukraine with its hypersonic missiles, the first time the weapon has been deployed in the conflict. An end to the bloodshed is still far from sight, with Russian leader Vladimir Putin now accusing Kyiv of stalling peace talks. Putin has demanded that Ukraine abandon its aspirations to join the European Union and NATO. Zelensky now signaled his willingness to proclaim a neutral Ukraine after requesting EU membership for his country. But as the war of words dragged on, the death toll is climbing on both sides, with civilians caught in the crossfire of historical grievances and geopolitical calculations. Sarah Wong, HKIBC.
On to the weather now. Mainly cloudy and foggy tomorrow, but also expect sunny intervals. Temperatures will range between 20 and 25 degrees. The rain will pick up on Tuesday, and beware of thunderstorms midweek. Now let's take a look at the weather around the world. That's our main news for Sunday night. Join us for more news at 11. I'm Johanna Chan. Thanks for watching. Good night.